Hey guys, this is Dr. Craig Banks. I'm here with my cousin, Dr. Jim Morgenstern.
How's it going, guys? Thanks for tuning in.
We're doing episode 16, long awaited, of Optimal Function podcast and videos here. We've had some craziness in the world that has prevented us from getting on live, and also Jim is now Daddy Jim.
That's right. Yeah, Grace is. So for those of you who maybe playing catch up here on the last 15 episodes, my wife and I back in April on the 21st we had our little girl. We actually didn't know what we were having up until the moment she came out, and she's awesome. She's already 15 months old and just hitting all these really cool milestones. And
15 months old.
15 weeks.
Weeks.
Yeah, it's crazy.
You said months.
Oh no, I'm sorry.
I was going to say she's aging at an advanced rate, Jim.
It's a crazy world we're living in. Kids are aging quickly. No, yeah. So she's 15 weeks old, and just a bundle of joy. And it's been kind of cool. I changed my work schedule a little bit, so that way I'm working primarily mornings, and then I come home for the rest of the day to help out with her and take the load off of Allie. And now that it's been past 12 weeks, Allie's back at work too. So kind of doing split duty, and it's a lot of fun because, you know, when you have both partners there, it's one dynamic, and then when it's just one person, you know, me or Allie taking care of her by herself, it's a whole nother ball game. And just now starting to get some really good sleep. She's sleeping, actually Monday night she slept almost 11 hours, so it's crazy. As soon as she found her thumb on the 4th of July, it's a game changer. So it's all new to me. This is our first baby, and it's just been a lot of fun. So learning something new every day.
Well, don't worry. Once she's like a teenager, like mine is, you won't sleep again because everything's
Fair
either
enough.
worried
I'll
or
need your cliff
aggravated
notes.
or ready to choke her out. So, but and then of course we've had the lovely coronavirus kind of delay in the world, and that's sort of
Yeah. Well, if I could share too, it was a pretty unique experience. You know, Allie and I, this is our first time having a kid, and we don't have anything to compare it to, but it was a crazy experience being at the hospital and not having any family allowed to be there. Myself being barely allowed to be there. You know, at that moment in time in April, they were really, really strict on everything, and you know, we were planning on having everything natural, and no joke, after about 30 hours of her being in labor, Grace just didn't want to come out. It was just, Allie was stuck at 5 centimeters. So they wanted to do a C-section. And if you guys remember too, the moment that you would go into surgery, they really weren't allowing the partner to be in the room. And, you know, shout out to Altman Hospital down in Canton, Ohio. They were actually one of the only ones who were still letting the partner go into the surgical room. And it was awesome because there was definitely a lot of uncertainty and anxiety, you know, for me, because, you know, you always worry about, could something happen during surgery? We were planning it being this way, but, you know, we're trying to make the best decision for her and Grace. And so everything went great. It's amazing how quickly from when they start surgery to when the baby comes out, I think it was maybe like 5 or 7 minutes. And it was the coolest moment in the world. So I won't go off on any further on that, but it's amazing. So, but yeah, crazy world we're living in. So that was just one little craziness amidst the beginning of all of this.
Yeah, and of course, you know, both of our offices we're mandating with masks and all this other stuff that, you know, we could do another entire episode on the mandates and all the different things. I mean, I think our perspective, since we did our last episode about the virus, our perspective has probably changed a ton.
Oh yeah,
You know, we
definitely.
were kind of dealing with something at the time we didn't really know that much about, so we were being as cautious as possible. It's still very real, still very serious, and you want to take all the precautions that you possibly can. But as we know now, the comorbidities, and it's funny how what we spoke about really has held up about taking care of your health, about minimizing your risk factors and that's not to say that there's not people out there with what appears to be no risk factors that are still getting sick, but for the most part, I mean, we were kind of dead on that. Just if you become a better host for the virus, you won't keep it as long, and or maybe you should say a worse host. But
Sure.
the quality of our health has made it such a huge difference in that. And like I said, we could deal with coronavirus for another hour-long episode, but that's not what we're here for today.
Right, exactly.
We just really wanted to kind of get back on track a bit, give you guys a couple quick topics, get back in the swing of things. We've actually got a couple really cool guests that have been waiting and asking to be on the show. So I'd like to try to get back to some normal things, and I think hopefully we can even do some in-person ones between Jim and I again, going forward soon. But what we wanted
absolutely.
to talk about was, first and foremost. Oh, and by the way, for those of you listening on the actual audio, there's some sounds of nature in the background because Jim's outside today. We got some lovely little birds in the background, and on the video part, he's got some nice trees and a little park.
I figure it would help with all the stressful times. We should all be out in nature a little bit more. I'm also just getting out of the house so I don't wake up Grace,
Good
so
point.
Allie can get a little sleep too. So, but
Good
yeah,
point.
how is the audio? Is it okay? A little bit soothing?
I think we'll be fine. You know what?
Okay.
We do the Calm app all the time. What do they have? They get the birds in the background or the waves or whatever. So we're building that in for you today for your audio listening pleasure.
That's right. Yes.
On that topic, what we're going to go with first with our optimal concepts is visualization. So I know I mentioned before the book, The Miracle Morning by Hal Elrod. One of the key pillars of what they do is talking about visualization every day and the power that has, just to kind of look and see where you want to be. What do you want out of life? And I know that's something I do. I know, Jim, you do a bit of it too.
Mm-hmm. Yeah, and it was kind of how I was raised. Both my mom and dad were real big on, mental imagery, setting a goal, visualizing it. I know you're going to use the word visualize quite a bit. It's hard to find a swap out word, but if the mind can conceive something and the heart can believe it, then we can achieve it. So I think, was that Muhammad Ali that mentioned something along those lines? You look at some of the really great athletes in the world, not only just taking that mental preparation, I guess it's just, again, I'm going to use the word visualizing yourself making that shot, but then also visualizing yourself waking up at 5 a.m., the touch of the ball, shooting it, watching it going through the net. There's little studies that show that just that mental picture of you going through those steps ahead of time sets you up for success so much more. And there's people out there who are skeptical that it's a lazy way for, you to sit back and not actually do anything about it. I don't think that's it at all. I think the true essence of it is to really find, let's just say, something that you're really passionate about and what your mind is set on, but going through that so that way it's already something that you've done and you've accomplished, and you've kind of get that almost that neural response that, hey, I've already been here and done that before. So I hope that kind of makes some sense. But heck yeah, every day, I mean, whatever it is, being a better dad, being a better partner, being a better chiropractor, whatever it might be, having a better workout, more focus when I walk into the gym, all that stuff really comes back to just that visualization.
And I think that, most people who are proponents of visualizing talk about specificity. So you want to be as specific as you possibly can as you're visualizing that. For me, one of the ones that I talk about a lot is the house that I live in. I didn't have it, and I thought that I probably couldn't afford it or whatever. I put it on the front of my phone, so it was my lock screen. So every single time I unlocked my phone, I would see this thing, and it would kind of propel me to see, well, what was it that I was working for at the time? What was the thing that I wanted? And I wanted to go to this place so that I could, have a different spot for my family, and so that I can enjoy some time with my kids. There's a pool here. So, I mean, there's a couple different things that I'm not trying to make it about material things, but that was something that I felt could be a good thing for my family and I. So that was what I did. But then with my son, and he had made it to wrestling states, we talked about that, and then it got canceled. But as he was getting ready to do the matches at districts to go there, I'd grab him and pull him in the hallway, and I'd make him close his eyes and picture himself going out on the mat, seeing what he was going to do, seeing the responses, and then most importantly, seeing his hand raised at the very end. And he did great. I'm not saying it was because of that, but did it hurt? Sure didn't. So I'm a big proponent of it, and you have to change it. You can't always do the exact thing. Like you said with the athletes doing practices too. You got to visualize the practice and the perfect practice and the training and the routine as far as waking up and doing the right things every single day. The more you see it, the more you're likely to do it. At least that's what I found out.
There's a pretty cool story too. When we're always looking up these different articles and whatnot to focus in on our podcast, you'll come across something that might, spark. And so Jim Carrey, the actor, this was before he became famous. I feel like Dumb and Dumber was the movie that they referenced, but years before that, I think it was about 3 years before that, he sat down and wrote himself a check for $10 million every day, just visualizing himself at one point hitting it big, being a real, great actor. And 3 years later, that was actually what he made from the Dumb and Dumber movie. So it's kind of silly, but it's also one of those things where, worked out really well for him. Arnold Schwarzenegger would always do a lot of visualization before he would get on stage to actually pose for the Olympia. He'd go through it, with his eyes closed, just sitting there in complete stillness. And that way he already knew. He didn't need a mirror. He just knew exactly what he was doing, right up there on stage. And then that played forward for when he was a politician and his acting career too.
I know I know we always interview these guests. Sometimes these are the best in their field or whatever. And we always talk about their mindset. And I know how many times you're going to hear what they do to visualize what they're about to do. I know with whether it be Phil Heath or Dave Bautista, or I've got a world champion bowler who I think we could probably get on here, or tons of athletes in all the sports. And when we interviewed Rich, he was talking about seeing that playing before the crowd and stuff. So
Yep.
it's not a joke. It's not something that's cheesy. And once you read and hear about how many successful people do this, at a certain point you sit there and wonder, if that many people are telling me that it worked for them, who am I to say that, oh, no, that's crap?
Right.
That blows my mind.
It's whatever works for that person. Nowadays we need any little tiny bit of positivity that we can add to our life to just stay focused, because a lot of our lives the past couple months, you mentioned structure, everyone's schedule changed and it threw off, our schedule on here. But then we also had to find that new normal for work, for family life, for having people come over to visit. And it's still not perfect, but every day we're trying to make it a little bit more of what we need just to get through.
Right. So we're going to move on probably to our Ask the Doc question. This is one near and dear to Jim's heart. The question is, I have a large bump on the underside of my kneecap in the front. It's painful. It's painful when I run. It's painful when I jump. What should I do? And obviously we can't internet diagnose you here, but chances are, if that's what you're dealing with a common condition called Osgood-Schlatters. And I'll let Jim kind of talk a little bit about his experience, because he dealt with this quite a while ago, but still even has some remnants of it today. So go ahead.
Oh yeah. So Osgood-Schlatter is seen a lot in active adolescents, kids that are, running around, jumping, landing, planting, and their bone growth plates are still active, and so they're not completely formed, and you have different tendons, which are where the muscle attaches to the bone, and it's tugging and pulling in different directions, and the body basically starts to lay down calcium as a response, as a stress response. And you'll see this again like in the adolescent population. So I'm 34 right now, and I probably dealt with this while 8, 10, 12 years old, and still to this day I have the remnants of that bump. And I can't say that my knees they don't hurt right now from that, but you can definitely if I kneel, I need something padded to kneel on, because there's just extra calcium sitting on there. For those of you, I'm actually wearing compression pants, so you may not be able to see it, but there's a pretty large nodule. For those of you who are watching on YouTube, there's a pretty decent nodule sitting right there where my finger's rubbing, and it's located just south of that kneecap. And it's actually where the patellar tendon attaches. So where your big quad muscle comes down, it anchors on what's called the tibial tuberosity or the tibial tubercle. And so it just kind of keeps tugging and pulling, and then you'll get a stress response, which is that calcific nodule or bump. So I kind of want to dive into what I remember doing back then. And, my dad, he was a chiropractor, he still is, and he dealt a lot with athletes, but I don't think they knew what they knew now. And so you kind of just did the basic minimum of what you knew at the time. And now I think there's some things that I would shed some light on, knowing what I do know. So back then it was the old Rice protocol, rest it, ice it, try to compress it, elevate it, which I don't think it did a whole lot. Really the rest might just be the main thing, is to let it kind of slow down the inflammatory process. Still to this day, they'll ask you to take NSAIDs, like a non-steroidal anti-inflammatory, which, you and I aren't huge fans of, and then just general stretching of the quads. So some of that still has some value. I think there's a benefit of stretching, but if you could overstretch an area that's already tugging and pulling on something, wouldn't you agree that can continue to, piss it off, for the, lack of a better word?
Yeah. So, when you do stretch, I think that there's a very specific stretch that has to be done, because, everybody wants to stretch a quad putting their heel to their butt. And I don't do that because I've had a couple knee surgeries myself. So when I stretch my quad, it's more of a middle bulk of the muscle stretch. So I actually keep my knee at about 90 degrees, put it up on a couch, and I know there's some videos out there. I'll try to insert a little picture of what I'm talking about on the video side of this. And then I sink down with the opposing leg. So my knee never goes past 90. I extend a little at the hip. So all of my stretch is at the medial, like the middle part of my quad, the bulk of my quad. And I don't feel anything at the patellar tendon, which is wonderful, because you don't want to stretch that patellar tendon out. That's what's pulling. So I'm with you on that.
Yeah. So that's what I remember doing a ton of, was just stretching. And it's nothing, that's not my dad's fault or anything like that. I think just at the time they're like, you know what, just go ahead and this is the stretch that should help. So what are you going to say? You're a kid, you don't know, you're just going to keep following it. But I do remember that the one thing that gave me a lot of relief was the patellar strap. Something that you put across there. I did a little search before we hopped on here. You can see them as cheap as $10 on Amazon, and they can go all the way up to, $40, $50, depending upon how many bells and whistles you want on it. But basically that strap, again, I'm going to show on the YouTube video, if the bump is here and this is my kneecap, the strap goes right across here and it Velcros. And what it does is puts an anchor point down, and it does provide a little bit of relief, especially if you're still going to be active, running around, jumping, landing. So yeah, basically that's, what we see in a lot of these kids now. I don't know if it's just they're not getting enough rest time in between sports. They're going from one to the other. If they were really active and maybe poor mechanics, and they're still growing, their growth plates are still active, you'll see this kind of increase, the intensity across the board. So nowadays, I think there's a lot more focus, at least the folks that I'm working with. I pump the focus in on, warming those joints up a little bit more, even if they're kids, kind of doing what we do here is we're, in our 30s and 40s, it takes a couple more minutes to get some blood flow to that area focused before you start really hammering out that sport specific movement. Yeah. So I think that's part of it.
They get so strong before the growth plates close, and they're being asked to jump, or I see it very frequently with catchers. So catchers in baseball or softball or whatever. So, and it can happen.
That extreme knee angle.
Yeah, men or women, but boys or girls, whatever. But that heel coming to the butt all the time. It's just this. If the quad is tight, it's going to lift that kneecap and overstretch the patellar tendon. And so you had mentioned about it laying calcium down. Well, the other option is it sometimes actually lifts the bone and creates almost an avulsion at the front part of the bone. So it could be either. And, the most extreme treatment, of course, is a surgery, and they have to go in and they take out little bone fragments that are underneath the tendon. And it's not good, because all that's going to do is create scar tissue. You're still not going to be kneeling in church comfortably later, because it might be bone fragments at one point, so you might lose some of the aggravation, the acute stuff, but it's still going to be uncomfortable, because that bump's not going to go away. They're not going to shave it down, because that's where your tendon still has to attach. So key on this, I think we can agree, is prevention and early treatment. Those straps, my opinion, is kind of the less complicated the better for the most part. I don't like all the ones with the big plastic pieces. I think they just get in the way and you have lower compliance. I like the ones with a little thicker pad, I guess, if you will, like just built into the strap that goes right underneath there. And you got to tighten them down. I mean, you obviously don't want to cut your circulation off, but they can't be loose there and expect to get any relief. It's basically trying to create a new tendon insertion point that your quad can then tug off of, and your quad's like pretty much the strongest muscle in your body. So one of.
The other thing too is for those who are just having a hard time visualizing, also we focused, I think, episodes back on like tennis elbow or golfer's elbow, where that same strap type idea will lay down a new anchor point for you to pivot the muscles off of, and providing a little bit of relief. But that's not the fix. You can't let that be the crutch. You still got to work on what exactly is happening across that, either the extensor group or flexor group. But just again, for those who haven't seen it,
I probably at the time dogged a little bit on those straps for the forearm. But the difference with the knee and why they work so much better with the knee is because the knee cap is there. So we don't have a kneecap in our forearm, so it's really hard to totally stop that tendon from getting pulled on in our forearm with one of those straps, but it works far, far better. The principle works way better in the knee. So
got it.
Finally, in my office, we use the MLS laser, and I had a kid who had a flare-up a couple weeks back to the point where you couldn't even, he was so swollen from it, you couldn't even see his kneecap. So I x-rayed him. I already knew he had Osgood-Schlatters, but I x-rayed him to make sure he didn't fracture anything. And I said, listen, this is just a flare-up, and it's really swollen. You got a lot of fluid around there. Tested him for ligament tears, cartilage tears, anything like that. It was all fine and good. It was just he had been practicing and working out, and it flared right up. We lasered him, and I'm not kidding you, inside of the session, in 9 minutes of working on this knee, his knee came back to normal. You could see his kneecap again, and his pain was substantially less. 9 minutes.
It's incredible.
So if you're around somewhere that has MLS laser, I'm going to be a strong proponent of that. And then finally, a little bit selfishly, the kinetic cream is pretty phenomenal on the inflammatory side of it to keep the relief going on. So if you need that, that's at kineticream.com. So, and it's on sale, I think, right now.
Shameless plug.
Yep.
It just works.
I don't care. Yeah, I don't care.
Yeah. No, it does work, so it's great.
I'd use this stuff, even if I didn't invent it, I would still use it in my office. That's the product that I would choose. So, All right. Awesome. So lastly, our final thoughts here. Again, moving back to the coronavirus stuff just a teeny bit, and we can talk for this for hours, but let's talk a little bit about the whole debate about whether or not kids should be in school or should be still doing distance learning or what. I know I feel a certain way. I think you feel maybe the same, but let's delve into that a little bit.
Sure. This is a hot topic. I get total polarization within the clientele that I work with. You got folks who 100% want their kids to go back. Within that population, is it primarily motivated so the kids get out of the house and they can go back to their, life from 8 to 5, of whether it's, a lot of parents now are working from home and they can't get much done because their kids are home, and they want their attention and, or what have you. And, so I see it both sides of the coin on that. So some parents really want their kids to go back to school, but now with them asking for kids to be wearing masks, there's parents who are like, I'm not putting my kids through that. I'll homeschool them, or they can do stuff, over the iPads, connecting in from distance learning. I'm not in the position to say one way is better than the other. I think if you just with that being said, Grace is only 3 months old, so she's not at the point where she's going to be going to school anytime soon. But from us just being humans and needing that interaction, and I think there's going to be such a huge disservice to these young kids if they don't get back around in that learning environment and being with their friends and learning from a teacher. And so I can see that if you had the ability to homeschool them and you're going to be able to, as a parent or what have you, to teach your kids what they need here. But I think there's a benefit of getting outside the house, meeting new kids, meeting their older friends, and just camaraderie, and being together like you and I did growing up. This is something, such a totally different frontier that we have never really had to go through. But can you imagine being in your house for months and months and months? And you and I, at least, were fortunate enough to have chiropractic be deemed essential so we could still get out and interact with people. But those first couple months, people were coming in and being like, you're the first person I've seen in weeks, or you give them a hug, or, you just have a good conversation with them. And there was almost this like borderline tearing up because they just haven't had that energy coming from a stranger or from another individual. So I think we're just older kids, now in our 30s and 40s, but we need that camaraderie, we need that interaction. And I think that's where I stand, is like, as much as we can get these kids outside playing maybe at a park or playing with their friends outside. And if we're being smart about it, that's another thing is just, let's not be idiots. Like, we saw weeks ago in Florida, people going on spring break and they're just on top of each other and, being really selfish and not paying attention to the small stuff. So I am leaning towards them probably being out more with their friends, getting that interaction back. And what say you?
I'm on the same boat, and for a lot of the same reasons, but a couple other ones too. I think right now with kids growing up the way they do grow up with a phone-driven society and a social media-driven society, there's so much interaction that becomes text-based or typing-based, and there's already a bit of a social awkwardness, I think, that comes out of a lot of young kids, and I'm sure anybody listening that's of that age will disagree, but I think most adults will agree. You have far more kids unable to function in society now than there was, 15 years ago. And I don't like to be that old fart or that old curmudgeon that's like, oh, in my day we had this or that, and, like, get off my lawn. That's not what I'm trying to be,
Right.
but it really was different, and I don't think that kids get enough interaction with adults or even to an extent other kids that is face to face or is in person. Everybody's sitting around and head down right in their phone, and we can be guilty of it too. But with kids, if we build that habit now, I cannot imagine what the future is going to be like. And then the mask thing, I don't like it for the kids. Because a lot of them are anxious. I had a kid in my office the other day, and he was literally in tears about having to go with a mask, and it's not right. These kids have not known normal for the last 6 months, and relative to the time that they have been alive, 6 months is a really long time. Every year you're alive, a year becomes a little bit less and less and less of the total portion of your life. So that's why years keep getting shorter and shorter. But 6 months for a 9-year-old, that's a long time. So I definitely think that that's one reason. And then the second one is, look, this virus is not really affecting kids. I mean, we gotta, you can always pull up one stat, and this kid had that, and he was only 1 year old, and he died. You know what I mean? Not to be callous, but people die, people get sick, and it's going to happen. And no matter what we do, no matter how much we hide from this, like we talked about before, you're not going to get rid of the virus, right? And that's not to say to not be smart, but at what point are we taking the mental welfare of our kids and learning ability in the future and throwing that aside for what realistically is a very, very low chance? And now some of the teachers are like, yeah, kids need to be in school. Maybe put them behind glass. You know what I mean? If the teacher's the biggest concern, that they're going to be the ones whose lives are on the line as far as being vulnerable and thinking that asymptomatic carriers of kids are the problem or whatever. And I don't think that there's a lot of asymptomatic spread from what the research is really showing when they let that out. If you were that concerned about it, make sure that the teachers are the ones doing the masks and doing the behind the glass. And hey, the teachers can drink some juice and have some, fruits and vegetables too, and they don't have to be going to McDonald's. They got to be exercising and doing their job too about taking care of their own health. So yeah, I'm on the side of that. And then too with the sports. I mean, some of these guys my son's a senior this year. If they decide to cancel sports, now I'm not saying his college future rides on him being an athlete, because he's doesn't need it. He's academically he's great, but some of these kids, that's their future, that whether it be football or basketball or, whatever it may be, even a case like wrestling. I mean, you're not going to probably become a pro wrestler because you wrestled in college, but at the same time, if that's what's going to pay your college tuition to become something that you may want to be, I just can't see that we just shut all this stuff down over what is really a very minuscule risk. Very minuscule. So that's where I'm at with it.
Yeah, no, you bring up a lot of really good points. It's just we got to really figure out what the pros and cons would be to take whatever it might be the next 9 weeks and shove them back home, and not let them go out and learn and get hands on. And it's crazy that it doesn't seem like it's going across, at least here in Ohio. It's not like all the schools are doing the same thing. Like locally in Akron, they're doing one thing, and then you've got individual school systems that are doing something completely different. So it's just like you almost wish it from the level of Columbus or state capital, they would just lay it out there, it being like this for all the schools.
Yeah, it would be nice to see some uniformity, especially in the sports world where you're doing stuff interscholastically. But, whatever. I guess at the same time, our governor here in Ohio has been a little bit wishy-washy, as it has been. Apparently yesterday he was tested positive for coronavirus, only to have hours later now tested negative. So that shows you the reliability of those tests.
Oh, man. Yeah. Well, and then Trump was also in town, right? He was up in Sandusky.
Mm-hmm. And that's why I think he was getting tested, because he was supposed to go do a face-to-face. So he tested positive, didn't do his face-to-face, then a couple hours later tested negative. I don't know. Like I said, tests are not perfect. We know that. We don't know whether the negative test was the inaccurate one or the positive was the inaccurate. Who knows, man? It's all a big guessing game at this point. I think you really have to just predominantly look at hospitalizations and ICU visits and deaths at this point. So, but let's get those kids back to school. And if you're a politician and you happen to be listening, let's be real with this, and let's get these kids what they need, and that's a good, healthy learning environment in the presence of their peers. So,
one more thing I want to mention too. Just you were going off on about the social media type age that the kids are really heavily dependent upon. Just want to shine some light on a few things that had come up this past couple weeks in the office, with a lot of parents just showing how their kids are being bullied even more through social media because their kid isn't have the coolest clothes on, or maybe their parents asked them to get off of social media for a little bit, so now they're being made fun of for not being on social media. It is so bizarre, because you and I didn't grow up with something like this. And now you're seeing these kids even more depressed and anxious to go back to school because they are being made fun of during quarantine for not being the coolest kid on TikTok, or, you know what I mean? Just dumb things that really don't mean anything.
Yeah. Sometimes it's a matter of whether or not they have the best filter on their phone. You know what I mean? It's really
Exactly.
stupid.
Exactly. It's so wild. But, parents, just maybe doing some things that really build up some good self-esteem and get your kids, away from those devices, because that stuff doesn't mean anything. It's just a freaking phone, and it's an app, and all of a sudden one day it could just be gone, and it wouldn't mean anything. Right. This means something: interaction, building relationships, building a future, building a plan, visualization.
Yep. All right, man. Well, I think we're probably going to wrap up here. I did want to say this is one of the new shirts from Phil Heath's line, Gifted Athletics. What
is that? A little hoodie on the back?
Yeah,
too?
It's a little hoodie. This is like t-shirt material. It's so comfortable. I mean, it's
sweet.
I get real hot, so I can't work out in something like this. But to go out in a nice place, and it's kind of like hero villain. And it's all about perspective, right? So sort of one person you're the hero, to a different person you're the villain, and it's crazy. We sit there and we play these roles. Most of the time, we don't realize we're always both. We're always both.
Nice. But, Phil, I'm a large, so go ahead and. Let me know. I'll rock it next time.
Nice.
And it won't show sweaty pits, too. That's great.
Exactly.
Great color.
Right color. All right, man. Well, listen, we're going to get back to this here again soon. Hopefully we're going to have an interview next time, and we'll keep it a surprise as far as who it is. But I think that's all I got.
Yep, that's all I got, too. Hope you guys have a great weekend. Thanks for tuning in.
All right. Take care, guys.